Hi, I'm Dr. Sari Priesand, and I'm part of the Michigan Medicine Podiatry team.
Hi, I'm Dr. Crystal Holmes, also a member of the Michigan Medicine Podiatry team.
In this video, we're going to talk about how to screen your feet twice daily, as well as what to look for if you have to call for an appointment.
One of the first parts of your self-examination is visual inspection. And this is really critical because it's the first step to identifying a potential problem. You can do this by using a long arm mirror or by using a door length mirror. If you're fortunate enough and you're flexible, you can also just bring your feet up closer to you and look that way. You can also employ the help of a friend or a family member, but it's important that you check both the sides, the bottoms, the tops of the feet, as well as your lower legs.
Specifically, things that you can look for would be any sort of toenail issues, any sort of ingrowing nails or loosening of your nails, or any pain in your feet. In terms of your skin, checking for any rubbing from your shoe gear, any dry skin, anything that looks different or out of the ordinary should be evaluated, or anything of concern that can potentially be open to infection and potentially cause ulceration.
I think it's key to note that if you see something that's new or out of the ordinary, those are all signs that you should seek medical attention.
Another thing to check for at home is if you have any bony prominences or foot deformities. This can include hammer toes or bunion deformity or potentially prominences on the bottom of your foot or the sides of your feet. Anything like that should also be evaluated as they can predispose you to ulceration or problems.
Evaluation of your shoe wear and socks are also critical when doing your self-examination. You want to check and make sure that your shoes aren't worn, don't have any holes in them, and that there's no debris inside. And you should check this several times a day. Also, if you have pets in your home, it's very frequent for dogs and cats to bring debris into the house and to leave them in small, dark places such as our shoes. The other thing that you want to do is look for wear patterns in your shoes. So if your shoes have holes in them, or if there's changes in the way that you're wearing your shoes, these are things you want to bring into the office so that we can help you evaluate them.
We also recommend a slow break-in period for new shoes. So that means not wearing a new pair of shoes constantly throughout the day, but slowly breaking it in so that way you can check for any sort of irritation or rubbing. In addition, checking your feet in the morning and at night can be helpful to make sure that there are no new issues that come up throughout the day.
If you have a pair of new socks, this is also a critical component to making sure that you have good foot health. So we advise patients to make sure that they have socks that are made out of a microfiber that's breathable. And we also suggest that you check the inside of the socks daily to make sure, again, that there's no debris inside of it as well.
It's important to realize that you should be checking your feet multiple times per day. This is because as you're active and on your feet throughout the day, your feet may change or there might be new issues that are developing.
Always have your physician's number handy. If you have a critical issue and you're concerned, you don't want to be looking and searching for your medical provider's information. So always have it posted in a very clear, marked place so you can find it in the case of an emergent situation.
Some of the things that we see here in our clinic are patients that have things like neuropathy, if they have history of trauma, any sort of deformity, all of that should be evaluated.
Many persons that have diabetes might experience neuropathy symptoms. This can include burning, numbness, tingling. Sometimes you can even experience sharp shooting pains. This may be something that you're dealing with on a regular basis, but if you have a change in those symptoms, this is something that should be evaluated.
And if you have neuropathy, you may not be sensing if there's anything happening at the bottom of your foot. You may not be able to feel it well. So that means that you may be able to step on something and not actually know it. So that's why it emphasizes the importance of checking your feet twice a day.
If you experience signs of infection locally, such as a warm, red, hot, swollen foot, if there's drainage or change in drainage if you've already have a wound, then those are also acute issues that you want to have evaluated. If you begin to experience systemic infection signs, such as nausea, vomiting, fever, chills, or diarrhea, these are all urgent signs of infection, warrant immediate medical attention, and you should contact your provider or go to your nearest emergency room. If you have a callus that has dried blood underneath it or a dark red or brown discoloration, this may not be a normal callus, but what is called a pre-ulcerative callus, and it is the first step to developing a diabetic foot ulceration. These calluses can be treated and we can prevent the development of a full ulceration, but it does require intervention.
Also, we evaluate peripheral arterial disease symptoms in screenings. If you are a current smoker or prior smoker, or if you have evidence of secondhand smoke, or if you even have pain or cramping when you walk, these can be signs and symptoms of peripheral arterial disease. You might also notice that you may be developing signs of bluish discoloration or signs of gangrene potentially in your foot, which really should be evaluated as soon as possible.
The American Diabetes Association recommends that all persons with diabetes have an annual foot exam. This exam is critical to ensure your foot health. If you have complications associated with diabetes, such as neuropathy, peripheral arterial disease, a history of ulcerations or amputations, you may require more frequent visits in order to maintain your foot health.
Thanks for watching this video, and we hope you learned how to screen your foot for foot problems, as well as when to call your physician if you have any questions or concerns.